Assalamu alaikum. Welcome all to Easy Human Anatomy channel. In this video, I discuss clavicle, one of the important bones of the superior extremity. Clavicle is a modified long bone, usually long bone situated straight and vertical, but this bone is S-shaped and placed horizontally at the root of the neck. The side determinations. The medial 2/3 is convex anteriorly, lateral 1/3 is concave anteriorly. The sternal end is expanded, the acromial end is flattened. The superior surface is relatively smooth, the inferior surface is bare, a groove for subclavius muscles. So this is expanded sternal end, flattened acromial end, relatively smooth superior surface, and this is the relatively irregular inferior surface. The inferior surface is marked by the groove for subclavius muscles. Here attachment of the subclavius muscle and margin is attached with the clavipectoral fascia. There is also a conoid tubercle trapezoid line. Here the conoid and trapezoid part of the coracoclavicular ligament is attached. Here the sternoclavicular joint is formed. This is the saddle variety of synovial joint. Acromioclavicular joint is formed here, which is flat plain type of synovial joint. Peculiarity of the clavicle: it is the only long bone that plays horizontally in the body. It is devoid of medullary cavity. The cavity which is present within the typical long bone is absent in this bone, and it is a long bone but it ossifies mostly membrane, another peculiarity, and it is the first bone of the body which start to ossify and last to complete the ossification. It is throughout the um, course it is subcutaneous, and occasionally it is pierced by the supraclavicular nerve. These are the peculiarity. Now the attachment: this is the superior surface, this is the medial 2/3, and anterior surface is attached origin of the pectoralis major muscle, which is innervated by the middle and lateral pectoral nerve. Both nerve is arrested from the brachial plexus. The sternocleidomastoid muscle origins and the insertion of the trapezius muscle in the posterior border of the lateral 1/3 of the clavicle, anterior part of the lateral 1/3 of the clavicle, origin of the deltoid muscle. Deltoid muscle is supplied by axillary nerve. Trapezius and sternocleidomastoid is supplied by the spinal part of the accessory nerve. So this is the origin of the sternocleidomastoid. This is the insertion site of the sternocleidomastoid muscles. So the origin is fixed, insertion is moved, so there is a movement of the scalp. So there is a two muscle present, sternocleidomastoid. It can act unilaterally or bilaterally. When unilaterally is contract, the pressure of the construction is toward the origin, insertion is moved, so it causes the rotation of the head to the opposite side, and the same side lateral flexions of the neck. When both muscles act together, the insertion is moved toward the origin, the contraction pressure is toward the origin, so it causes the chin bring to the chest and the head is flexed, and when the insertions are fixed, origin is moved, it helps to increase diameter of the thoracic case. It increases the vertical diameter, and this muscle is used in the force inspirations. So this is the direction of the contraction when the origin is moved toward the insertion. Another muscle is the subclavius muscle, and the margin is attached with the clavipectoral fascia. Clavipectoral fascia is cover its two muscle, one is subclavius, another is pectoralis minor, and it's continuous with the axillary fascia. And the inferior surface, there is also a rough area near the sternal end for the costoclavicular ligament, very strong ligament. And you see the another ligament, the coracoclavicular ligament, which is two part, the conoid part and trapezoid part. It's very important ligaments because the weight from the axial skeleton is passed to the upper limb by this ligament. So this is the subclavius muscle. Behind it, the branches of the subclavian artery vein and brachial plexus is present here. So fracture of the clavicle is not causes injury of the nerve of the brachial plexus due to the subclavius muscles. So this is the clavipectoral fascia, which cover the two muscles, subclavius muscle and pectoralis major muscles, and it is continuous with the axillary fascia. The pectoralis major muscle, this is origin. It has two head of origin. One head arises from the sternum, another head arises from the clavicle, and this is the insertion in the bicipital group, lip of the bicipital group, and it can move in both directions. When the origin is fixed, insertion is moved, it causes the flexions of the shoulder joint. When the insertion is fixed, origin is moved, it acts as a climbing muscle. So medial two-thirds of the clavicle posteriorly, there is important relationship. The divisions of the brachial plexus is present behind the clavicle. This is the brachial plexus, which is formed by the cervical 5, 6, 7, 8 and thoracic 1, and the upper two root is unite from the upper trunk. Middle one is run alone from middle trunk, and lower two roots, cervical 8 and thoracic 1, is unite from the inferior trunk. This is situated in the posterior triangle of the neck. Then each trunk is divided anterior and posterior division, anterior division, posterior division, posterior division, anterior division, and all posterior division is unite from the posterior cord. The anterior division of the superior or trunk and middle trunk unite from the lateral cord. The anterior divisions of the inferior cord is from the medial cord. So the divisions of the brachial plexus situated behind the clavicle. This is the axillary artery, very important to identify the cord of the brachial plexus. You see lateral to it, lateral cord, medial to it, medial cord, and posterior to it, posterior cord. And from the lateral cord, musculocutaneous nerve is arise. From both lateral cord and medial cord, median nerve is arise, and from the medial cord, ulnar nerve is arise. And from the posterior cord, two important nerve is arise, radial nerve, which supply the muscle of the posterior compartment of the arm and forearm, and this is the axillary nerve, which supply two muscle, deltoid muscle, alternatus minor and it is related with the um, surgical neck of the humerus. Any fracture in this particular area damage axillary nerve. This is sternohyoid muscle. This is the deltoid muscle's origin. It is the U-shaped origin from the clavicle, from the lateral margin of the acromial process and inferior lip of the spinous process of the scapula, and it is inserted into the deltoid tuberosity of the humerus. It has three group of muscles: anterior fiber, middle fiber, posterior fiber, and it has different function. This is the trapezius muscles. The ligaments related with clavicle, I already discussed the coracoclavicular ligament, conoid part and trapezoid part. The coracoclavicular ligament is not torn in clavicular fracture. The clavicular in fracture fragment remain relatively stable because of the ligament still anchor clavicle to coracoid process. This usually result in minimally displaced fracture. The clavicle held in place despite pull of sternocleidomastoid muscle and weight of the upper limb downward. So this is the conoid trapezoid part. This is conoid part is torn, and due to the pull of the sternocleidomastoid, the medial segment is go upward, and due to the weight of the upper limb, the lateral segment is go downward. There are two joints present related with the clavicle: sternoclavicular joint and acromioclavicular joint. Sternoclavicular uh, sternoclavicular joint is special type of joint because its joint cavity containing articular discs divide the joint cavity into two cavity, and so the range of the movement is like ball and socket type, and due to the articular discs, different type of movement, multiple movement is possible in this joint: elevation, depression, protraction, retraction, and circumflections. And it is the only true joint connecting the upper limb to the axial skeleton. The acromioclavicular joint is a plain type of synovial joint, and it is small gliding movement is present here and help in the scapular rotation. Other ligament of the clavicle: anterior posterior sternoclavicular ligament, and this is costoclavicular ligament, and acromioclavicular ligament, and this is coracoclavicular ligament. The fracture of the clavicle we partially discussed. There is a two-part is fracture usually occur at the junction of the medial two-third and lateral one-third, where two curve is unite. This is the weakest point. The medial fragment is go upward due to the pull of the sternocleidomastoid muscles, and the lateral segment is go downward due to the weight of the upper limb, and it is also goes medially due to the contraction of the pectoralis major muscles. Lastly, we discuss a congenital anomaly related to the clavicle: cleidocranial dysostosis or dysplasia, a rare congenital skeletal disorder involving defective intermembranous ossifications. Affected bone mainly clavicle, skull bone, because clavicle and skull bone mainly ossify from the intermembranous ossification. The clavicular defect, hypoplastic or absent clavicle, patients can't um, move their shoulder in front of the chest, a classical sign. Another skeletal features narrow thoracic thorax, delay closure of the cranial suture or fontanelle, and multiple supernumerary teeth and short stature and wide pubic symphysis. Now the ossifications of the clavicle. There is a two primary ossification center is developed during 5th to 6th week of the intrauterine life, and there is a secondary ossification center near the sternal end which fits with the um, shaft uh, near 25 years. So it is used to determine the age of a individual. So this is all about clavicle. If you find this video helpful, thank you. Please subscribe my channel and thank you for watching.